So how much physical activity do people need? Because people, will want to know, is it 2 hours, 30 minutes? So could you explain that a little bit, please?
So this would vary from person to person and would be based on individual circumstances. Most people don't do the recommended amount of physical activity. And it's really important that we get this message out that people could really benefit in terms of their quality of life, their well-being, and the support that's already out there to help people become more physically active. So the Department of Health recommends that adults should aim to be active daily and complete about 2.5 hours of moderate intensity activity over a week. So that's the equivalent to 30 minutes 5 times a week.
Okay, and so if someone's thinking, right, I want to start being more physically active, do you have any good places that they could start?
So the first thing to say is it's never too late to start, no matter how old you are. So I know my mother, who's in her mid-80s, and me speaking to her about how can she keep active at home. She doesn't go out very much now. So it's never too late. Even people that are bedbound, Fatima, can remain active to some degree. And it's really important that people who are bedbound know how to, if they're able to, kind of keep active to some extent. So, for example, we all know if, for example, you're flying and you're in a plane for 6, 7, 8 hours, they tell you how to keep your calves, your legs moving, and definitely not to sit for 7 or 8 hours in one place because it's actually really unhealthy. People can have serious medical conditions. So, the advice is to get up, walk around, even though you're on a plane, and keep your legs moving. Okay. The other thing to just be aware of is the more we can build in for our children, the importance of activities and exercise from a young age, the more likelihood is that they're going to then carry on these routines as they get older. And it's important to also recognize that physical activity goes hand in hand with having a healthy and balanced diet. And the Quran mentions quite specifically the importance of the benefits of water intake, eating fruit and veg. It actually mentions pomegranates, dates, fish. So really, there's a fair amount written about the importance of having a healthy diet in Islam. I just wanted to mention something about brain plasticity, Fatima. Do you know what that is?
No, I don't. I don't know what that is.
So brain plasticity. So when I started medical school, the general thing that I was taught at that time was when the brain is damaged, for example, with a stroke, the brain doesn't have that much capacity to recover. Now, what we know is that despite damage to the brain, given the right kind of help, support and management, you can actually do a fair amount for the brain to actually start to work around that damaged area a lot more. So it's never too late to realize the benefits of exercise on brain functioning. I'd like to just share with you my own experience of eating more healthily and wanting to lose a bit of weight, if that's okay.
Yeah, please.
So I can remember about 4 years ago going to a regular checkup at my doctor's, and they said 2 things. First of all, my weight was more than what it should be. And the second thing was they did some blood tests and my cholesterol was a bit high. And also I had borderline diabetes. So the advice given was you really need to lose some weight. And I can remember that I went home, spoke to my wife and said, what can I do to actually eat more healthily, lose a bit of weight? And my wife quite quickly kind of turned around and said, here's what you should read. Read The Fast 800 by Michael Mosley. And her take on it was she had already lost 8 kilos. And so it worked for her and she really wanted me to read this book. Fatima, do you think I read it?
I would think you did. You did read it, because if it worked for your wife, then maybe it would all work for you.
I didn't read it.
All right.
Why do you think I didn't read it?
Because you wanted to try a different way?
Okay, yeah. What was my wife doing? She was telling me what to do.
Oh, of course, from our last
Okay.
podcast. Yes.
She was telling me what to do.
Yes.
The brain doesn't like to be told what to do.
Yeah.
The brain likes to think for itself.
Yeah.
What I did do at that time was I went through some coaching questions. Why is it important for me to eat more healthily? What will I get by actually doing more exercise? What will be the benefits of it? What are the barriers standing in my way? So I actually did some coaching questions, and after that, I started to eat more healthily, and I started to do some regular walking. And I weighed myself right at the beginning, ate healthily, walked regularly for a month. And at the end of it, I weighed myself, Fatima. What do you think happened? Did I lose weight?
Yeah, I'm gonna say you lost weight.
I was devastated.
Oh no.
I lost nothing.
Okay, right.
Right? Nothing changed.
Yeah.
I was eating healthily, I was
Yeah.
walking, and what did my wife say?
You should have read the book.
Yeah, my wife said, I told you to read the Fast 800.
Yeah.
Did I read it, Fatima?
I'm gonna guess you didn't.
No, what was she doing?
Telling you what to do.
Okay.
Yeah.
Now, if she'd asked me a good question, I might have thought about it slightly differently.
Yeah.
But I didn't read the Fast 800. But look, I can be a bit stubborn. But at the same time, I do know the fact that, if something has worked for somebody, then I need to think a little bit more about it. So I did. So I thought a little bit about my thinking, and I did a couple of things. I went back to the questions that I'd asked myself about eating more healthily and losing some weight. Okay. And one of the things I came across was keep a diary of what you eat. And I remember going to my wife then and saying, I'm too busy. There is no way I'm going to keep a diary. How can I get past this point?
Yeah.
And she did something amazing. Within 30 seconds on my iPhone, she downloaded an app that actually monitors really easily what I'm eating throughout the day.
Yeah.
So that's the first thing. But the other thing was a really positive thing that I hadn't realized. The app actually monitors how much exercise I'm doing as well. So that was the first thing. The second thing was I asked my wife, if I was to ask you one thing the Fast 800 says that I should take up, what should that be? And she said that one thing she would recommend I do is have lunch. And really important, I was missing lunch because I was too busy. So that's quite paradoxical, the fact that I should eat something to actually get to a better weight, okay? But the idea is really simple. If you're missing meals, the body doesn't like it. The biochemistry, the hormones, everything else in the body fights against that. So actually, I did those two things. The first thing is I downloaded the app and started to monitor what I was eating. And the second thing was I started to have a healthier lunch. And what that really did for me was very quickly, and this is a little bit embarrassing, but I realized that as I was monitoring what I was eating, I realized that I didn't know what a calorie was. So having been a doctor for so many years and advising my own patients, I realized I didn't know that a banana has roughly about 100 calories. Sliced white bread, one slice, about 100 calories. And what this did was the app allowed me to start becoming more aware of my thinking and more aware of how active I am. And that allowed me to start planning what is it that I want to do to become healthier. So it's that raising awareness again. And then the last thing I did was, instead of waiting for a month to realize, have I lost any weight? I weighed myself once a week. So that was the only other thing I did. So those three things, really, after a month, I started to lose consistent weight, okay, in a healthy way.
So the way I see it is, it's not really about the counting calories. It's about almost kind of accountability and, as you said, awareness of your habits.
Yes, because you always overestimate, I'm doing a lot of exercise, when really I may not be doing as much.
Yeah.
Okay.
Yeah.
And just to kind of stress that point, I started to lose weight. I had my blood tests at my doctor's surgery. My cholesterol level came down. My blood sugar levels came down.
Yeah.
So just by that simple act of exercising a bit more, eating more healthily, allowed the quality of my life to actually, my lower back pain that I have got better.
Yeah, yeah.
Okay. And to think we've just had 2 years of COVID, and if I imagine now that I was an Asian male in his 50s and overweight, diabetic potentially, okay, high cholesterol, the risks that would have put me under in terms of during the COVID pandemic would have been huge.
Yeah. Okay, so thank you. I'd like to ask if you could give us a few almost short top tips to being able to exercise better.
So the first one is around the stage of change that we mentioned in the last podcast.
Yeah, the thinking one.
The thinking one, okay? Becoming more aware of our thinking at the different stages. Really, really important, okay? And the act of thinking about something but then talking about it like we're doing now, Fatima, raises awareness. When you write something down or you monitor something like I did on my app, it raises awareness again, okay? You then plan something, and before you know it, it begins to change the way you're actually living your life quite dramatically. The second one is when you're starting to start slowly, and especially being aware of physical health problems that you might have, medications that you might be taking. So in my case, I've got some quite severe lower back problems. So I'm not going to go and do a marathon, but it doesn't stop me from walking and walking in a way that is really beneficial. The third one is around, rather than walking for a whole hour, walking short bursts. Okay, so do 20 minutes throughout the day rather than one whole hour. And how can you get involved with other people doing physical activity? Really, really important. So there is more likelihood I walk when I'm going out and walking with my wife, for example. And if you're doing that, how can you make it more fun? Anything that introduces fun into your daily routine, you're more likely to repeat it. And the last tip would be around have a range of different things that you can do to keep active, not just one or two. The more different things that you have, short bursts, the better.
And do you have any almost kind of examples of types of exercise?
So not going straight to joining a gym and doing cardio and all of this business, which is great. I'm not saying people shouldn't do that. There is a place for that and people should. But let's just say people that aren't doing any exercise at all, how can you really start? Some simple things. So the first one is as simple as it gets. Do more standing. What do I mean by that? We could be actually talking now, rather than sitting, standing up. Lots of evidence to suggest that when you're standing up, it impacts on your physical well-being in lots of different ways. Your blood pressure, your blood sugar levels, your muscle tone, your balance. So the act of standing is really, really useful. And some good research done in the 1950s when they compared bus conductors compared to bus drivers. And they found that bus conductors, those people that used to give you your bus tickets, were a lot more healthier and had fewer physical health problems compared to bus drivers. And you'll have heard, Fatima, of people having desks at home now. What are they called?
There's just standing desks.
Yes. So really simple thing that everybody can do. The second one is this idea of having less exercise but more frequently. Exercise snacks is the way that Michael Mosley talks about it. So standing up every 20 minutes. Going for a very quick few minutes walk, brisk walk every 20 minutes, going up the stairs, anything that allows you just to kind of get your body moving rather than staying still, sitting down in one place. The third one is one that we've mentioned previously, is about the power of walking. And brisk walks are really, really beneficial, especially first thing in the morning. So our listeners, some of them, if they get up for Fajr prayer, right, first thing in the morning, going to the mosque, really, really useful. The act of actually walking first thing in the morning is much, you can walk at any time and it's going to be good, but first thing in the morning in particular. The other one I want to just share with you, Fatima, is initially might sound a bit odd, but practicing standing on one leg. So before you do that, you just need to risk assess your environment. We don't want you to be falling over.
Yep.
But in a safe space, to stand on one leg for 10, 15 seconds, how long you can manage, and then repeating that for the other leg. And what you find is often older people as you get older, your balance isn't as good. And by doing this exercise, it actually is really good physical activity. So I often start to now brush my teeth in the morning. Can I brush my teeth by standing on one leg?
Yeah.
And if you really want to challenge yourself, again, really safe environment, attempt standing on one leg with your eyes closed.
Mm-hmm.
The last one is around building strength. So strength exercises. And these are things, again, you can do in the home environment, but just need to make sure physically you're well enough to do some of these things. So these are press-ups, squats, the plank. You can find YouTube videos on these. Really, really useful, easy ways of keeping active. And given my lower back problem, I've had some sessions on Pilates. And I compared Pilates to praying 5 daily prayers. But it is very, very much total body workout that is really gentle. And so that takes into account my lower back problems. And it's done really a lot for me, kind of building that activity level up.
Okay, so after this interview, or towards the end of this interview, could you give me just a small summary, a few almost just bullet points of everything that we've spoken about?
So well-being, as we said, is lots of different things linked together, working together. And it's slowly introducing each of those things in our daily routine. The analogy that I'd like to give is our bodies, if you think about it, we look after our cars, we take them for their MOT, we service them. In order for that vehicle to do what it needs to do, you really need to look after it. And our bodies, to some extent, are no different. We really need to be aware of our bodies and be able to kind of keep them in good shape. And the more you can think about how you can introduce some of these things that we've talked about today, the better and the easier it gets. So if people want to learn a little bit more about this, Michael Mosley, who I mentioned earlier, he actually has a 15-minute podcast on one thing. And it is just standing on one leg. And there's science behind this. And he really shares the science behind, if you do this one single thing, how it can benefit you. So, and you can also go on the NHS Choices website, which has a number of resources for people who are interested in wanting to become more active. Lastly, the British Heart Foundation, Health at Work. Lots of useful tools people can use to be more active at work. Okay,
well, thank you very, very, very much, Dr. Khan. Is there anything else that you'd like to add onto the end of that?
No, that's been an absolute pleasure, Fatima, and thank you for giving me this opportunity to talk to you.
No, thank you so much for giving up your time to talk about all these different and important topics. And a lot of preparation really does go into these podcasts, especially on Dr. Khan's side. So thank you very, very much. So that is the end of our 4th podcast in our well-being series. We have one more left, and that is going to be more focused on prayer. And so I imagine would be more of a religious element brought into that one. If you would like to listen to any of our previous podcasts, then you can find the whole podcast on sleeping, breathing, thinking, and now physical activity on our YouTube channel and also on our website. So thank you again for listening, and hope that you can listen soon to our next podcast. Goodbye.